What if I told you the entire nutrition system, from your doctor's advice to school lunch menus, was built on religious visions and cereal company profits, not science? Today, I'll show you how meat was demonized, low carb was buried, and the grain based lie became the law of the land. Hi everyone, I'm Marc Bates. I'm a metabolic health coach, and this is part of my question and answer series. Exposed: How Big Food and Religion Hijacked Our Nutrition Guidelines. So let's get to the question. You mentioned that the American Dietetic Association was financially tied to Kellogg's and Sanitarium while defending grains and dismissing animal based therapies. How exactly did these corporate religious partnerships function to suppress contradictory research? What were the specific mechanisms they used to bury or misrepresent low carb trials that challenged their narrative? Very fundamental question. The suppression of low carb, animal based therapies in favor of plant based, grain heavy dietary guidelines involved a well organized alliance between the Seventh day Adventist Church and their religious ideology and corporate partners who typically were processed food industry, especially Kellogg's and Sanitarium. These groups leveraged institutional control over education, research funding, media narratives, and policy advisory boards to ensure their ideology prevailed even when scientific evidence contradicted it. Here's how these mechanisms functioned in practice. Start with institutional capture. You need to control the dietetic education. So, founding the American Dietetic Association, the ADA, were Linda Francis Cooper, trained at Harvey Kellogg's Adventist-run Battle Creek Sanitarium, and co-founded the ADA in 1917. For 30 years, all major dietetic textbooks in U.S. medical training were authored by Adventist-trained dietitians, promoting a vegetarian grain-based diet as healthy eating. This meant future dietitians entering the profession already believing meat was harmful, without exposure to data showing low-carb benefits for diabetes and metabolic disease. Then you get to the financial influence and corporate partnerships. Direct sponsorship of ADA and other nutrition bodies. Kellogg's and Sanitarium, who were Adventist owned at the time, both became major financial backers of dietetic associations, including the Dietitians Associations of Australia, which required members to actively defend cereal grains and sugars messaging as part of their corporate sponsorship agreements, and similar sponsorship models exist in the U.S., with Kellogg's funding ADA conferences, education programs, and public campaigns. These partnerships ensured that any narrative promoting grains and processed cereals was protected and amplified, while competing messages, for example, low carb, carnivore, ketogenic approaches, were labeled as dangerous fads. Next comes gatekeeping of the scientific publications and research funding. So, industry supported research bias. Studies funded by Kellogg, Sanitarium, and aligned other organizations often used epidemiological surveys, which are food frequency questionnaires, prone to healthy user bias. Vegetarian eaters more health conscious overall, typically, right? Allowing associative data to frame meat as harmful. Downplayed or omitted metabolic mechanisms showing carbohydrate intolerance and diabetes. Avoided long-term controlled trials comparing low-carb animal-based diets to high-carb grain-based diets, preventing definitive evidence from entering guidelines. You had the suppression of contradictory findings. So here's a couple examples from Richard Feynman's book, Nutrition in Crisis. Data showing carbohydrates increased cardiovascular risk in the Nurses' Health Study were omitted from official conclusions because they contradicted the fat is harmful, carbs are safe narrative. And multiple trials indicating no benefit or harm from replacing fat with carbs sat unpublished or buried in archives for decades, right? Finally, you have influence on peer review. Nutrition journals receive significant advertising revenue from processed food companies. It's a conflict of interest, obviously. And once again, goes back to my ultimate statement: follow the money. Papers questioning the grain-based paradigm faced hostile peer review, were labeled non-standard, or rejected for being unethical, especially in recommending low carb to diabetics despite its clear efficacy. Okay? Next, you get the media and public messaging control. Corporate-funded public health campaigns. Kellogg's and Sanitarium published public nutrition campaigns framing breakfast cereal as essential to health, linking animal fat to heart disease without causal evidence. Low-carb diets were portrayed as harmful, risky, or quackery in press releases, magazine articles, and early TV health segments, shaping public opinion before scientific debate could occur. And then you had the vilification of meat and low-carb advocates. Physicians like Dr. Robert Atkins and Dr. Richard Bernstein were marginalized as dangerous, even as their patients reversed diabetes and obesity. Dietetic associations actively campaigned to science practitioners, recommending low-carb approaches. So, for example, Gary Fettke's case in Australia, where a wonderfully trained physician, right, was investigated for telling patients to cut sugar and processed carbs. That was his crime, was telling people to eat healthy, right? But not the way the sugar companies wanted him to talk. So the net effect was through education capture, funding bias, publication suppression, and aggressive public messaging. This religious corporate alliance created a closed-loop system. They train the dietitians under vegetarian doctrine. They fund the research that supports grains and cereals. They suppress or misrepresent evidence favoring low-carb diets. And they label animal-based therapies as harmful to maintain grain dominance in policy and food markets. This explains why, despite decades of data showing that carbohydrate restriction reverses diabetes, improves insulin sensitivity, and outperforms high-carb diets, official guidelines still recommend grain-heavy, plant-based eating patterns, a legacy of Adventist ideology married to corporate profit motives. And finally, obviously, follow the money. Okay, thanks for watching, everyone. If you have a comment or a question, please leave it in the appropriate section. This is the community. We're here to help you get the answers you want. If there's something I'm not covering or you want me to build a future series on, let me know, and we'll get to work on it, because I want to help you get what you want from this channel. Also, if you haven't done so, please like this video, subscribe to the channel, and share this with friends. It helps the channel a great deal, and you'll be helping a lot of other people in the meantime. Thank you very much.